Hello everyone and welcome to Edusurg Clinics. I am Dr. Gunjan Desai. I am a consultant GI and HPB surgeon at Lilavati Hospital. And today we are going to discuss some common risk factors, causes of upper GI cancers, that is food pipe and stomach cancers. And we are going to look at the common symptoms and signs as well as some preventive strategies for these cancers. So it's commonly asked, can we prevent cancer? Where there are some ways in which you can prevent cancer, or at least you can identify it early, and that can help us in achieving a cure for a particular presentation. So let us have a look. So first of all, let us see where these organs are located in the body. I am sure most of you know, but just a quick revision. This is the area, it is the thorax or the chest where the food pipe is located, and going into the abdomen, this is where the stomach is located. Okay. So basically, just to simplify this diagram, from mouth, the food pipe or the esophagus, and the stomach. So these are the organs that we are going to discuss. Now, food pipe as an organ is a conduit. Basically, it provides mucus, but more or less a conduit for the food to reach stomach. So transit of food from mouth to stomach is through the esophagus, whereas stomach produces the digestive enzymes and acid and begins the process of digestion. Also helps to fight infection. It's the acid of the stomach that neutralizes a lot of bacteria and also helps in vitamin B12 absorption. So these are some of the basic functions of stomach. As the food goes ahead in the intestine, the mixing of food with digestive juices is aided and begun in the stomach, and then it continues and it goes towards the intestine. Now, coming to the risk factors of food pipe cancer or the esophagus cancer, tobacco is one of the most important risk factors, and tobacco consumption in all forms predisposes to food pipe cancer. So it's not that if you're taking a cigar or a pipe, then the risk is less and BD has higher risk. All these tobacco forms have risk for esophagus cancer. Alcohol consumption is a risk factor. Consumption of hot beverages has been a matter of debate, but excessive consumption of hot beverages has been linked to esophagus cancer. So that is one of the risk factors. Obesity and physical inactivity is also a risk factor. Long-standing acid reflux disease should be treated because it becomes a modifiable risk factor for food pipe cancer. Achalasia, that is a motility disorder of food pipe, also predisposes to squamous cell type of esophageal cancer. Long-standing anemia or Plummer-Vinson syndrome is a risk factor. And from food pipe to stomach, the pre-existing diseases affect these areas because the stomach contents can reflux into the esophagus, and that is what can lead to mucosal changes in the food pipe and predispose to cancer. So it is this reflux that we need to identify and treat early, and that is one of the ways which provides a scope for prevention. So for all other cancers, similarly for esophagus cancer, alcohol and smoking cessation, it can be a goal. Reduction is a target which should be achievable. Physical activity, exercise, a healthy lifestyle, and diet is the scope for prevention. But you can also prevent the acid reflux disease. So treat the reflux, treat anemia, and put the patient, if there is chronic long-standing acid reflux, for surveillance for Barrett's esophagus. And these are again scopes for prevention or early detection of esophageal cancer. Non-modified risk factors can be hereditary, such as Fanconi anemia and familial Barrett's esophagus. Males are more predisposed and old age is a risk factor. Now coming to stomach cancer, the risk factors again are tobacco consumption in all forms. Smoked and salted meat and pickles are also associated with risk factors for stomach cancer. Pre-existing disease is chronic gastritis. So if you have seen all these videos, it's very simple to understand that if there are long-standing diseases such as chronic pancreatitis, chronic liver disease, or chronic gastritis, all of the chronicity in this disease predisposed to cancer. If there has been a previous gastric surgery, long-standing bile reflux can predispose to malignancy. Severe vitamin B12 deficiency or pernicious anemia with atrophic gastritis is also a risk factor for malignancy. Epstein-Barr virus, like COVID virus, is a virus which can predispose to stomach cancer. Similar to food pipe cancer, stomach cancer, the scope for prevention is the same. But for early detection, it is upper GI endoscopy, identification of Helicobacter pylori infection, and treatment of anemia. So you have scope for prevention as well as early detection of food pipe and stomach cancer. And that is why they are being discussed together, known as upper gastrointestinal tract cancers. And if you come across these risk factors, you should consult your doctor. Non-modified risk factors for stomach cancer are again hereditary disorders. You have something known as a hereditary diffuse gastric cancer, and a prophylactic surgery is offered to these patients. Hereditary non-polyposis colorectal cancer as well as familial adenomatous polyposis. Both of these are colon cancer hereditary syndrome, but they also predispose to stomach cancer. Li-Fraumeni syndrome or P53 mutations and Peutz-Jeghers syndrome is also hereditary risk factor for stomach cancer. Family history of risk gastric cancer is very important, and that is why I always say that this is one data point where you can identify patients for screening and prevention. That if there is positive family history, it is very important to screen these patients and rule out cancer. Personal history of gastric polyps is also a risk factor. Gender and age we have already seen in food pipe cancer. Same applies to stomach cancer. Symptoms of upper GI disease, I am sure most of you know: reflux or regurgitation, chest pain, acid coming in mouth or water coming in mouth. So difficulty in taking things down, that is difficulty in swallowing, or things coming back up, that is reflux and regurgitation. As for all cancers, unplanned weight loss, loss of appetite, and early satiety are very common symptoms, and they are red flag signs for cancer. Easy fatigability, tiredness, and weakness are symptoms of anemia, and if that is present for long term, it can predispose to cancer. Patient may be harboring pernicious anemia, which has not been detected. Chronic cough, hoarseness of voice, or increased cough in night. These symptoms occur because of long-standing reflux. Because the reflux happens in food pipe and then it trickles back into the upper pharynx or the oral cavity. Okay. What happens is this acid causes sore throat kind of symptoms and leads to chronic cough, hoarseness of voice, and increased cough in night. Nausea or vomiting can be present with or without blood. Worsening of symptoms. We always say that for all patients with chronic disease which are being on screening or surveillance, if you notice worsening of symptoms, it is a very important sign to screen these patients for malignancy. So if any of these factors are noticed, immediately consult your doctor. Now, when we talk of stomach disease, you can again have upper abdominal pain or heartburn. Weight loss and loss of appetite is quite severe. Anemia can be present. You can have melena, that is black colored stools, smelly stools, abdominal bloating and distension if the stomach is blocked as an outlet, and nausea or vomiting. Similarly, worsening of symptoms of pre-existing disease. If any of these are noticed, you should contact your doctor immediately. So if you know these symptoms, if you know the risk factors, that is when we can think of prevention strategies. So diet: avoid smoke, salt, pickled foods, consume fresh foods, avoid processed meat, increase fresh fruits and vegetables. In lifestyle, I always say the goal is cessation of alcohol and smoking. An achievable target is at least reduction of alcohol and smoking. Weight control and exercise is important. Treatment of pre-existing disease reduces the risk. So investigate and treat anemia, treat Barrett's esophagus or long-standing reflux, treat the Helicobacter pylori infection. If you treat these diseases, the long-standing diseases can be taken care of and the risk of cancer can be reduced. If there are hereditary syndromes or family history that is present, the patient may need genetic counseling and at least surveillance, if not surgery. If you identify any of these symptoms or risk factors, meet your doctor immediately. For all patients with chronic disease, similarly, chronic gastritis and chronic reflux plus or minus Barrett's, awareness and education to have a regular follow-up with the doctor is very important. Screening should be done for identifying cancer as early as possible. Screening tests may require an endoscopy, may require blood markers, may require a CT scan or a PET CT. The decision to do this depends on your doctor. Thank you.